tomorrow. We learned of the first case last week when one of the guest workers tested positive, and our EPI team quickly began interview close contacts and provide public health guidance, and worked closely with the owner of the orchards and the Vermont Agency of Agriculture to implement isolation and quarantine. Because there was a risk of spread among the farm workers, we decided to offer testing to all of them over the weekend. Of 101 people tested, 27 workers had positive results. For those of you who follow these numbers closely, you may recognize that we noted 26 yesterday. The 27th was from the same batch of labs that were sent over the weekend. It just was delayed in getting a result back. I'll also comment that for the entire state yesterday, there were 4 new cases, none of which were in Addison County. Contact tracing has been completed, and at this time, the outbreak is contained to the site. And as I said yesterday, I want to emphasize once again, there is no known risk to the public. There's also no risk in eating apples or any other products that were grown or produced by the orchards. And if you've been apple picking in the past couple of weeks or visited the farm stand, you're not at risk either. We thank the owner who's complying with all of our public health recommendations and for working with us to put measures in place to keep anyone who may be contagious from coming into contact with other workers at the orchards. The orchard owners and state agencies are working to make sure these workers have what they need: food, shelter, and other things to quarantine and isolate safely. Now, in light of the most recent national events, I hardly need remind Vermonters of the nature of the virus. It spreads quickly and easily, especially among groups of people who, by necessity, like our guest laborers, live close together. People do not get sick because they are from a certain place or they are of a certain ethnicity or nationality. They get sick if they're exposed to the virus. But the virus spreads just as well among those who you would expect to be the most protected, but who don't take basic precautions: wearing a mask, keeping a distance, avoiding crowds. Testing is detection. It is not prevention. It's vital that Vermonters know the facts about COVID, learn from trusted sources who will tell you the truth, even as we learn more about the virus. Do not be distracted or swayed by so much chaos and political theater at the top. COVID-19 spreads because it is a highly contagious virus that is in the air we all breathe. As the weather turns and we spend more time inside together, taking COVID safety precautions is more important than ever. I'd like to now comment on another mechanism for spread. In the past few weeks, it was reported that the CDC had put up and quickly taken down a statement on its website referring to so-called airborne transmission of COVID-19. Well, as of yesterday, it was up again. I've mentioned this phenomenon a number of times, and I wanted just to recap it at this time. Airborne transmission, sometimes called aerosolization, is not novel. It's an important way that infections like tuberculosis, measles, and chickenpox are spread. As opposed to the large respiratory droplets we commonly say are the major mode of transmission of COVID-19, airborne transmission means infection spread by exposure to the small droplets and particles that can linger in the air for minutes or sometimes hours. To get infected this way, you can be further than 6 feet away from the infected person, and even get infected when the person no longer is in the room. This form of transmission has been thought to occur within enclosed spaces that did not have adequate ventilation, where the infected person was breathing heavily. For example, in the literature, there are reports of singing or exercising, like in a choir practice or an aerobic class in a closed studio without windows. Now, nothing I've said should change the way you try to prevent yourself from contracting COVID-19, because large droplet transmission is still the number one way and the major way you could get the virus. So the 6-foot spacing and the masking are still terribly important. What also becomes important, especially in winter, is avoiding crowded and or poorly ventilated spaces, as good ventilation reduces exposure to all particles of any size and at all distances. And avoiding crowded spaces, of course, minimizes the type of close contact that is primarily responsible for the spread of this virus. I'll turn it back to the governor now.